Hello, my name is Emile. I'm an orthopedic surgeon that's a co-owner of Allure Anti-Aging and Rejuvenation Center. My wife is the other co-owner, and we're very proud of the center and what it's accomplished so far. It's a very few months of being open, and we appreciate you coming to share a little bit of the history and the future for the center with us. In terms of what our mission and vision is for the center, is we're trying to provide the leading edge, cutting edge, alternative medicine to all aspects of patients that can value a more kind of vivacious improvement in their lifestyle, their general health, and try to avoid some more of the conventional medicine that's already been well documented, have problems in terms of complications from surgical procedures and problems with taking medicines on a long-term basis. So we're trying to do this as optimize the natural outcomes for people and to stymie some of the aging and degenerative processes that occur in all of us. So we're trying our best to optimize our current status, to limit how impactful the aging process is to us in the future, and to optimize our capacity to enjoy the present. So that's the basic mission and vision of this center. In terms of that, what we have basically is the backbone is what I describe as the three pillars of this center. The first being the overall general health and wellness, which is sometimes called lifestyle medicine. That is headed currently by Dr. Therese Harris. She's a very accomplished OBGYN physician who has taken a special expertise in bioidentical hormones, and she also treats a wide variety of disease processes, not only with bioidentical hormones, but other conventional methods. But she's very keen on optimizing the patient's own body by providing resources in reference to dietary changes and lifestyle changes, in addition to the dramatic effects that can take place once someone has well-calibrated bioidentical hormones applied. And that's certainly her area of expertise. She is assisted by John Bjorkman, who is an accomplished dietitian and coach. She was a former executive for many years and really had her interest piqued when she was exposed to this as an executive a number of years ago. She embodies what wellness is really all about. She is pretty firm in her commitment to excellent dietary work, and of course she understands the psychological well-being that's needed to have the best results both inside and out. So she is a nice complement to Dr. Therese Harris, and they work together. The second pillar is, of course, what's called the aesthetic medicine, which I clearly recognized when people look good, they generally tend to feel good. And we built this beautiful salon in part because that would support this second arm of that, the three pillars. And the aesthetic medicine, as will be spoken to by my other associates that work here at Allure, is very accomplished. It involves all of the typical facial treatments, from injections and fillers all the way down to waxing. We have access to lasers, PRP treatments, and so on and so forth, but I'll let them go into the details. In addition, there are women's and men's sexual health and women's incontinence treatments we have available, and those treatments have many benefits to them as well, and are all relatively non-invasive. The final pillar that we have is called regenerative medicine, and regenerative medicine is my particular area of expertise. I'm an orthopedic surgeon, and I've always enjoyed providing orthopedic surgery treatments for patients, but very early on recognized that there are certainly limits to what we can accomplish in the OR. And even though sometimes as surgeons we feel very accomplished by certain activities in the OR, they don't necessarily translate to good outcomes for patients. So about 11 years ago, when I started my private practice, and nearly 12 years ago, I already was starting platelet-rich plasma treatment, and I did a lot of my athletes' treatments with platelet-rich plasma. And over the past 2 years, I've been involved with stem cell treatment. I've become an expert locally in stem cell treatments, and have attended courses and done a lot of trials in my own hands about varying types of stem cell treatments. We've been applying them to predominantly joint injuries, but also to tendon and ligament injuries orthopedically. In the future, we're also going to be using stem cell in this center for hair loss treatments, as it's shown already some good improvements with just PRP alone. And we may even be part of a protocol, IRB governed protocol for IV stem cell potentially in the future, where the patient could get an intravenous injection of their own stem cells and have that work more globally or systemically in the body for people particularly with rheumatoid arthritis, Parkinson's, stroke patients, this kind of thing. So that's what the future holds. And finally, we're about to announce in the near future the addition of massage therapy once we officially have that approval. We have been told it's already been approved by the city, and we will add massage therapy as that is an important adjunct to overall wellness. So I'm pleased that you're here to enjoy our beautiful center, and I hope that you find it as rewarding as I do. Thank you.